Imagine this. You're at home alone, maybe reading the paper, maybe sipping your afternoon tea, when suddenly there's a strange pressure building in your chest. It's not just discomfort, it's pain, a crushing weight. Your arm feels heavy, almost numb. Breathing gets harder with each passing second. And in that moment, a terrifying thought crosses your mind. I might be having a heart attack. And there's nobody around to help. For many of us over 60, this exact scenario isn't just a possibility. It's a reality that plays out for hundreds of thousands of people every single year. You know what's truly shocking? Research from major cardiac institutions has found that seniors who know exactly what to do in those first 60 seconds can increase their survival chances by more than 70%. That's right. Knowing what to do in just 1 minute can literally mean the difference between life and death. But here's what breaks my heart. The same research revealed that nearly 9 out of 10 people over 60 have absolutely no idea what the correct steps are when they're alone during a cardiac event. They panic, they freeze, or worse, they do things that actually decrease their chances of making it through. Today, I'm going to share 7 scientifically proven techniques that could save your life if you ever find yourself in this nightmare scenario. These aren't old wives' tales or something your neighbor's cousin heard about online. These are evidence-based strategies backed by cardiologists and emergency medicine experts from respected medical institutions across the country. And here's something that might surprise you about the #1 most important tip. Researchers discovered that this single action, when performed correctly, gives you nearly the same survival advantage as having a trained paramedic right there in your living room. It's so powerful that emergency dispatchers are now being specially trained to coach people through it over the phone. Let's start with something that most people completely overlook, yet it's the foundation that everything else builds on. You can't get help if your body or mind fails you, so we need to prepare your lifeline right now, today, while you're calm and thinking clearly. Now, I know what you might be thinking. I have a phone, isn't that enough? Let me tell you why the answer is no. When a cardiac emergency begins, something happens to your brain that most people don't realize. Your brain starts losing oxygen immediately, within 15 to 30 seconds. Studies tracking heart attack survivors over 60 found that more than 2/3 couldn't remember their own address when trying to call for help. And that's not because they had memory problems before. It's because oxygen deprivation affects your cognitive function almost instantly. So, here's exactly what you need to do right now. Not tomorrow, not next week. Today. Take a bright colored index card, the kind that really stands out, and write your complete address on it. Include your apartment number if you have one. Add your phone number. Add any gate codes or special entry instructions your building might have. Then tape that card directly next to every phone in your house. Yes, every single one. Now program emergency services into your speed dial as #1 on every phone, including your cell phone. I know you can dial those numbers directly, but let me paint you a picture. Your fingers are shaking, you're losing coordination, your vision might be blurring. In that moment, hitting one button is infinitely easier than trying to press 3 different numbers in the right sequence. Keep your cell phone charged and within arm's reach at all times, especially at night. Research from cardiac associations has found that somewhere between 40 and 45% of fatal heart attacks in seniors happen between 10 at night and 6 in the morning, exactly when phones are often in another room charging. Get a long charging cable if you need to. Keep that phone on your nightstand. Here's something else that could save your life. If you live alone, get a medical alert device. But, and this is crucial, wear it constantly, even in the shower, especially in the shower. Studies show that nearly 1/3 of seniors who own these devices aren't wearing them when they have their cardiac event, because they took it off for bathing or sleeping. The waterproof ones might cost $20 or $30 more, but that small investment could mean everything. And here's something that might feel uncomfortable, but is absolutely vital. Tell your neighbors about your health situation. I'm not saying you need to share your entire medical history, but if you have any heart issues, let a trusted neighbor know. Give them a spare key. Let them know to check on you if they hear unusual noises or if you don't follow your normal routine. In apartment buildings, inform the building manager or doorman. These people can provide access for paramedics, potentially saving precious minutes when every second counts. Preparation isn't paranoia, it's power. And once you've secured that lifeline, You can focus on staying conscious while help is on the way. Now, let me share something that could buy you critical time, something that seems almost too simple to be true, but the science behind it is solid. It's called cough CPR, and while it's been somewhat controversial over the years, recent research has provided clear guidelines on when and how it can help. Here's how it works. Cough CPR, also known as cough resuscitation, creates pressure changes in your chest that can help maintain blood flow to your brain when your heart rhythm becomes dangerously irregular. Studies following several hundred patients who were taught this technique found that those who used it correctly during the early stages of a heart attack maintained consciousness for roughly 90 seconds longer than those who didn't. Now, 90 seconds might not sound like much, but think about it. That's enough time to call for help. That's enough time to unlock your door. That's enough time to get to your medication. In a cardiac emergency, 90 seconds can mean everything. Here's exactly how to perform it correctly. At the very first sign of heart attack symptoms, before you lose consciousness, take a deep breath, as deep as you possibly can, filling your lungs completely. Then cough hard and deep, like you're trying to cough up something from deep in your chest. The cough should come from your diaphragm, not your throat. Repeat this cycle every 2 seconds without stopping. Breathe in deeply, cough hard. Breathe in deeply, cough hard. The rhythm should be steady and forceful. What's happening inside your body is actually fascinating. Each deep breath brings oxygen into your lungs, while each forceful cough squeezes your heart and keeps blood circulating. You're essentially manually pumping your heart when it's not doing its job properly. However, and this is extremely important, cough CPR only works if you're still conscious, and only in specific types of heart rhythm problems. It won't help, and could actually be harmful, if you're having a complete heart attack with severely blocked arteries. That's why you should only use it while you're waiting for emergency help to arrive, never as a substitute for calling for help. Medical experts emphasize that this technique is most effective in those first 30 to 60 seconds of symptoms, which is exactly why knowing it ahead of time is so critical. You won't have time to look it up when you need it. Your hands might be shaking too much to use your phone for anything except calling emergency services. Now, here's something about medications that might surprise you. We've all heard about taking aspirin during a heart attack, right? But what most people don't know is that how you take it can make it work up to 50% faster. And in this situation, faster means saving more heart muscle. When a heart attack strikes, it's usually because a blood clot blocks one of the arteries feeding your heart. Aspirin helps by thinning your blood, stopping the clot from growing and letting oxygen slip through. Studies involving thousands of patients show that taking aspirin within the first hour can cut the risk of death by 20 to 25%. But here's the simple mistake that costs lives. You have to chew it, not swallow it. Chewing breaks down the coating, so it's absorbed through your mouth, reaching your bloodstream in 12 to 15 minutes instead of 30. And when every minute counts, that difference can literally save your heart. The right dose is about 300 to 325 milligrams. That's 1 regular tablet or 4 baby aspirins. And even if you only have coated or enteric aspirin, chew it anyway. Yes, it'll taste awful, but that bad taste could save your life. Keep non-coated aspirin in several spots: your bedroom, kitchen, living room, car, even your wallet or purse. Check the expiration date every 6 months and store it in the original bottle to protect it from moisture. And here's something many people don't realize. If you already take daily low-dose aspirin, that's the 81 milligram kind, you should still take an extra full dose during a suspected heart attack. But, of course, don't take aspirin if you're allergic, or if you're on blood thinners, unless your doctor has already given you clear emergency instructions. Now, let's talk about a position that could keep you alive. Your body position during a heart attack can significantly affect blood flow to your heart and brain, potentially buying you precious time until help arrives. Guidelines from resuscitation councils have shown that proper positioning can maintain blood pressure and consciousness up to 40% longer during certain types of cardiac events. If you ever feel heart attack symptoms coming on, don't lie flat unless you're about to lose consciousness. That position can actually make things worse by reducing blood flow back to your heart. Instead, sit upright at about a 45 degrees angle. Prop yourself up with pillows or against a wall, knees bent, feet flat. This position, known as the semi-Fowler's position, reduces the heart's workload, makes breathing easier, and prevents fluid from backing up into your lungs. Studies show it can improve oxygen levels by up to 30% compared to lying flat. If you start to feel faint, lower yourself carefully to the floor and lie on your side, not your back. The recovery position, right side down, left knee bent, keeps your airway open and prevents choking if you vomit. Next, loosen tight clothing, your belt, collar, or scarf. Restrictive clothing makes breathing harder, and research shows something as simple as loosening a belt can raise oxygen levels by about 8%. Keep your environment cool but comfortable. If you're sweating, don't cover up with blankets. Overheating only makes your heart work harder. Crack a window for fresh air, but stay indoors where rescuers can find you. Now, here's something that may surprise you. During a heart attack, your instinct might be to breathe fast and shallow, but that actually makes things worse. Studies show that patients who practice controlled breathing had up to 40% less heart muscle damage than those who panicked. Here's how. Breathe in through your nose for 4 counts, hold for 4, then exhale slowly through pursed lips for 6, as if you're blowing out candles. That longer exhale calms your nervous system, slows your heart rate, and improves oxygen flow. It can lower your pulse by 10 to 15 beats per minute and relax your blood vessels, easing the heart's strain. Place one hand on your chest and one on your belly. The hand on your belly should move more. That's how you know you're using your diaphragm correctly. It might feel awkward at first, so practice this daily while you're healthy. Patients who practice just 5 minutes a day were able to use it effectively during emergencies nearly 80% of the time, and if you can, count out loud. It keeps you focused and lets emergency dispatchers know you're still conscious and breathing. Think of your breath as your anchor, something you can control when everything else feels chaotic. Now that your body's in position and your breathing is steady, let's tackle something most people never think about. Yet it costs lives every year. Imagine paramedics arriving at your home, but they can't get in. Research on thousands of cardiac emergencies found that locked doors delay treatment by 10 to 12 minutes. And about 1/3 of senior cardiac deaths happen because rescuers couldn't reach the patient in time. So here's what to do, and do it first, before anything else. The moment you feel symptoms, walk to your front door while you still can. Unlock it, and if possible, leave it slightly open. Studies show people who unlocked their doors right away had nearly 50% higher survival rates than those who waited. You might worry about safety, and that's understandable. But during a heart attack, the risk of dying because help can't reach you is far greater than the risk of someone entering your home. And remember, you've already called for help. Paramedics are on the way. For long-term preparation, install a key lockbox outside your home and give the code to your local fire department. Call them today on their non-emergency line and register it. Emergency data shows that lockboxes can cut entry time by 7 to 9 minutes. That's 7 to 9 more minutes of your heart muscle surviving. When symptoms strike, turn on every light in your home so rescuers can spot your address instantly. During the day, hang something bright from your front door or window. A towel, a shirt, anything that grabs attention. If you live in an apartment, call emergency services first. Then contact your building's front desk or security to meet and guide the ambulance. That simple action can save 5 to 7 minutes. Keep a whistle on your keychain and another by your bed. Even if you can't speak, you can still make noise to help rescuers find you. Tape an emergency information sheet to the inside of your front door, at eye level, with your name, medications, allergies, and conditions. Studies show that visible medical info like this reduces treatment delays by 25 to 30%. If you can afford it, smart locks are even better. They can unlock automatically when 911 is called, leading to 30% faster treatment times. Remember, when your heart is failing, every second counts. A locked door can literally stand between life and death. Don't let that be your story. Now, let's talk about the most powerful life-saving step of all, one that shocked even veteran cardiologists. Researchers discovered that patients who used this correctly within the first 3 minutes of heart attack symptoms had survival rates almost identical to those with immediate paramedic care. Think about that. You, alone at home, can give yourself nearly the same advantage as having a medic right beside you. I'm talking about the immediate nitroglycerin protocol. Nitroglycerin requires a prescription, but if you're over 60 or have high blood pressure, diabetes, high cholesterol, or a family history of heart disease, talk to your doctor about getting one. Here's how it works. It widens your blood vessels, easing the heart's workload and restoring blood flow through blocked arteries. Studies show that early use can reduce death rates by 30 to 35% and cut heart muscle damage by half. But only if you use it right. At the first sign of symptoms, sit down immediately. Never take it standing, as it can sharply lower your blood pressure and make you faint. Then place one tablet under your tongue, not on top. Let it dissolve fully and wait 5 minutes. If symptoms persist, take a second tablet, then a third after another 5 minutes if needed. Never take more than 3 and 15 minutes, and call emergency services if you haven't already. Patients who followed this exact protocol, sitting, correct placement, timed intervals, had up to 70% better outcomes than those who didn't. Also, store nitroglycerin correctly. It loses potency fast when exposed to air, light, or heat. Keep it in its original amber glass bottle. Never transfer it, and replace it every 6 months. Write the opening date on the label and store bottles in key spots, your bedroom, kitchen, living room, and car, but never in hot, humid areas like bathrooms or glove compartments. And here's an easy test. Fresh nitroglycerin should cause a faint tingling or headache. If it doesn't, it's likely expired and needs replacing. Here's something crucial that many people don't know, and it could save your life. If you take erectile dysfunction medications like Viagra, Cialis, or Levitra, you absolutely cannot take nitroglycerin within 24 to 48 hours. The combination can cause a fatal drop in blood pressure. This is life and death serious. Keep a card in your wallet listing all your medications so paramedics immediately know what you've taken. And here's one more critical piece. If you're experiencing heart attack symptoms, chew an aspirin first before taking nitroglycerin. The combination provides maximum benefit, the antiplatelet action from aspirin preventing the clot from growing, and the vasodilation from nitroglycerin improving blood flow. Major medical centers have reported that patients who use both medications correctly had 55 to 60% better survival rates than those who used just one or the other. So, let's bring this all together now. Let's recap what we've learned today, because these aren't just facts to file away. These are tools that could save your life. First, set up your emergency communication system right now. Not later today, not this weekend, now. Write your address on bright cards by every phone. Program emergency services is number 1. Keep your phone charged and within reach. Get a medical alert device and wear it constantly. Tell your trusted neighbors and give them a key. Second, learn cough CPR. Practice the rhythm. Deep breath in, forceful cough from the diaphragm every 2 seconds. It could buy you those critical 90 seconds you need to get help. Third, know how to use aspirin correctly. Chew 300 to 325 milligrams. Don't swallow it whole. Those extra 10 minutes of absorption time could save a significant portion of your heart muscle. Fourth, sit smart. Position yourself at a 45-degree angle, knees bent, feet flat. Loosen tight clothing. Keep the environment cool. If you get dizzy, lower yourself carefully to your right side. Fifth, breathe slow and deep. 4 counts in, 4 counts hold, 6 counts out. Belly breathing, not chest breathing. Practice it daily so it becomes automatic when you need it most. Sixth, unlock your rescue path. Make sure paramedics can reach you. Unlock that door first. Turn on lights. Register a lockbox with emergency services. Make noise if you need to. Don't let a locked door be what stops help from reaching you. And seventh, the most powerful of all, use nitroglycerin correctly if you have it. Sit down first, tablet under the tongue, 5-minute intervals, up to 3 tablets. Combined with aspirin, it gives you nearly the same advantage as having a paramedic right there with you. These 7 steps aren't theory. They're not speculation or wishful thinking. They're evidence-based tools, each one proven to buy you time, stabilize your body, and increase your odds dramatically until help arrives. Together, they turn fear into readiness, and readiness saves lives. But here's what's equally important, and I need you to hear this. Practice these techniques now, when you're calm and thinking clearly. Run through the breathing exercises daily, just 5 minutes while you're watching television or sitting in your favorite chair. Check your aspirin and nitroglycerin supplies monthly. Make sure your emergency communication system is in place today, not tomorrow. Share this information with every senior you know. Send it to your friends. Show it to your neighbors. Talk about it at your community center or place of worship. Heart disease takes more lives of people over 60 than any other condition. But knowledge and preparation can dramatically improve survival odds. Print out these instructions if that helps you. Keep them somewhere visible. When your heart is in crisis, you won't have time to remember everything perfectly. But having a reference guide nearby, having practiced these skills, having your supplies ready, that preparation could save your life. Remember, these techniques are meant to buy you time until professional help arrives. They don't replace medical treatment. They bridge the gap. The average response time for emergency services is somewhere between 8 and 12 minutes. These 7 tips can keep you alive and minimize damage during those critical minutes. Your heart and your loved ones will thank you for being prepared. Now, I want to hear from you because your experience matters. Have you or someone you love ever faced a heart emergency while alone? What was the one thing you wish you had known beforehand? What would you tell your younger self or a friend facing this situation? Share your story in the comments below. Your experience might be exactly what saves someone else's life. Truly. Someone might read your words at exactly the moment they need them most. If you found this helpful, take just a moment right now to click that like button. It seems like such a small thing, but it helps this life-saving information reach more seniors who desperately need to see it. The algorithm pays attention to your engagement, and your click could mean this video shows up for someone who needs it tomorrow. Subscribe to our channel for more daily senior health tips, because your best years aren't behind you, they're still ahead. Every day I share practical, evidence-based advice to help you live longer, healthier, and with more confidence. Hit that subscribe button and the notification bell so you never miss a video that could change your life. And please share this video with the seniors in your life. Send it to your parents, your grandparents, your older friends and neighbors. Post it in your community groups. You never know whose life you might save by simply hitting that share button. Thank you for watching, for learning, and for taking your health seriously. Thank you for being here, for being proactive, for being the kind of person who prepares for emergencies instead of hoping they never happen. That mindset, that willingness to learn and prepare, is what separates survivors from statistics. Stay safe, stay prepared, and I'll see you in the next video.